I am unfortunately able to confirm that a patient who is currently being cared for in the Brownlee Infectious Diseases Unit at Gartnavel Hospital has tested positive for Ebola. The patient is a health worker who has been working with Ebola patients in West Africa. The patient returned to Glasgow late last night and, after feeling unwell, was admitted to hospital early this morning. The patient is currently stable and is in isolation at the Brownlee Hospital, pending transfer to the UK's high-level isolation hospital in London. The patient is thought to have had contact with only one other person in Scotland since returning to Scotland last night, and that person will also be contacted and given appropriate reassurance.
The patient identified themselves as having a fever the early hours of this morning and made contact with healthcare services, who subsequently made contact with ourselves. She was transferred to the Brownlee Centre using a kind of specialist ambulance service and was admitted to ourselves using well-established, well-practised protocols. She's being managed in an isolation facility by staff who are comfortable managing patients in such a situation. She herself is quite stable and is not showing any great clinical concern at the minute.
I think, as you probably know, this is a virus that's mainly transmitted through bodily fluid, and clearly, as First Minister said, the healthcare workers did not have any symptoms which will lead to transmission to other passengers or crew members or anyone else in the community. The reason why we are contacting or trying to contact the passengers in the planes to make sure that they get the right information rather than getting misinformation quite often from other people. So we want to reassure them personally by making a contact with them to make sure they get the message, and also just to let them know what the symptoms are. And like any other diseases, if they have any symptoms, they need to contact NHS for further information.